Hey everybody, hope y'all are doing well. We are going to talk about vital signs today. So let's go ahead and just jump right into that. All right, so vital signs. This is something that every MA does almost every single visit with every single patient, every single day for the rest of their lives. No, it only seems that way. But vital signs are truly important, all joking aside. We do this, like I said, every single patient, every single visit, every single day. Now, a caveat to that is that there will be some specialty clinics that may or may not do all of them every single time, or may not do any of them every single time. It really just depends. But for the most part, vital signs are done every single visit. So let's go ahead, if you would please. If you haven't already, click the like and subscribe buttons. It really helps me out and allows me to bring more content to you like this. All right, so let's get started here. So, like I said, vital signs are checked at every visit. It helps to establish the patient's state of health, number one. Um, Number two, it gives us kind of a baseline measurement. So if the patient is brand new to the office, then it allows us to kind of see what the norm is for them. But as far as establishing the state of their health, it also helps us to, decide whether or not they could be ill or something else is going on. Vital signs include, not an exhaustive list, of course, but temperature, pulse rate, respiration rate, pulse oximetry sometimes, and blood pressure. So let's see what all those mean. So let's start with temperature. Okay. Temperature, the whole purpose of taking the temperature, again, is to establish that baseline and to monitor for abnormalities. So what is abnormal, right? Normal is 97 to 99 degrees Fahrenheit, and we generally take our temperatures in Fahrenheit. The average body temperature then is 98.6 degrees Fahrenheit, which I'm sure you've heard in the past. Um, Abnormalities, on the other hand, look like this. So, what we consider a fever, or what is better known as pyrexia in the medical terms, is anything that is above 100.4 degrees Fahrenheit. What a fever is and what it means or translates into basically is that heat is being produced faster than it's being lost. Okay. We also term that as being febrile. The reason in most cases that heat is being produced faster than it's being lost is if we are ill, right? One of our body's mechanisms to fend off illness, especially those types of disease-causing pathogens that can't survive over a certain temperature, is to heat up to kill them. So that is 9 times out of 10 the reason for a fever. Sometimes it can be environmental, though. You're just in a too hot of a place. A low-grade fever is considered 99 to that 100.4 mark. Hyperpyrexia, or just a really crazy high fever, is anything above 105.8. This is a very serious condition. This can be very damaging, and near life-threatening. Life-threatening, fatal temperatures are anything above 109. Some people may succumb to it at slightly lower, but 109 is kind of the fatal mark. 105.8 and above, you're looking at possibly brain damage, convulsion or seizure. Just it's really, really serious. So you have to cool that person down and get them treated immediately. The opposite end of the spectrum would be hypothermia, which is being too cold, right? Anything below 97 is considered hypothermic. Wow, maybe I'm a little hypothermic. And this is classified as being subnormal. And basically, it's just the opposite. Heat's being lost faster than it's being generated. And people can generally not survive below 93.2. That is a fatal. Any temperature below that is generally not survivable. And hypothermia is generally environmentally driven. Out in very, very cold weather for too long, in very, very cold water, like a river falling into a river or something like that for too long. And those people just need to be warmed up. All right. What can cause these variations? Well, besides environmental factors, emotional states with being too warm. Sometimes when you get really upset or you start crying really hard, your face will turn red, you get a little too warm. Exercise, obviously, because what generates heat in our body mostly is muscle contraction. So as our muscles contract when we exercise, heat is being generated. So we get a little warmer than normal. Pregnancy, usually for metabolic reasons. Pregnant females are just, kind of in a state of chaos physically, and so their bodies are a little warmer than normal. Or it could just be the patient themselves. Some people tend to run a little warmer. Some people tend to run a little cooler. I myself, as an example, tend to run a little warmer. And so I always try to warn anybody that takes my temperature, like an MA or somebody in the office, to let them know that I'm probably going to look like I have a low-grade fever, but I'm fine. All right, where do we take temperatures? There are different assessment sites. Some are better than others. But here's the rundown. So you can take them in the mouth, the axilla, which is under the armpit, the rectum, the ear, the forehead, which is called temporal. Um, how you choose a site really depends on several things. It depends on the patient themselves, so their age, their condition, their state of consciousness, um, the type of thermometer you have available. I mean, some offices just don't have certain thermometers. So you use what you've got. And then the policy in your office. There could be policies written on what type of thermometer you use on what types of patients. And if that's the case, just follow your policy. Okay. Start with an oral temperature. Oral temperature is convenient. It's very common. It uses this guy here that's on screen, this digital oral thermometer, and it is electronic, takes the measurement in about 4 to 20 seconds, depending on what kind you have. You don't want to use these with infants or small children because they just can't follow directions properly and keep the probe underneath their tongue. Or anybody that has a breathing problem. I mean, if they can't breathe through their nose, you don't want to make them keep their mouth closed. So that would be an issue. Also, please pay close attention to this right here. This blue tip. I will mention that again here in a minute, but just, blue. Remember blue, okay? An axillary temperature is taken with the same type of thermometer, but it is put underneath the armpit and then the armpit's held down. You can use this on small children. They may not cooperate with you, but you can try. Not accurate. About a good degree Fahrenheit lower than an oral temperature. This honestly, for me, would be my last resort if I had to take a temperature. It's just not an accurate way to do it. Okay, rectal temperature. Complete opposite, very accurate, probably one of the most accurate methods. And remember I said the color I told you to remember? What was it? Blue. Okay. This is red. Red means rectal. Okay. Please do not put a red tipped thermometer in someone's mouth. Would just be gross. Okay, so that's why we have the differences. So red is rectal, blue is oral. Okay. Again, it's digital. It measures about 1 degree Fahrenheit higher than an oral temp. Good for infants, young children, unconscious patients, mouth breathing patients, if a greater accuracy is needed. So if the provider asks you to do it because he or she feels that it's very important to be very accurate with the temperature. It should not be used on newborns. So infants fine. So like, I always say 2 to 3 months and up. But Newborns, no, because there's a danger of causing rectal trauma if you use it in newborns. They're just too small. Tympanic thermometers. This is what you use here. This guy on screen, that's called a tympanic thermometer. Slightly more comfortable. Um, I disagree with what, yes, I made this PowerPoint, and yes, this is what the books say, okay? I kind of disagree with using this in some children younger than 6 or uncooperative patients. Children, especially because they just kind of freak out because they don't like stuff being stuck in their ears necessarily. So sometimes you're kind of chasing them around with it, and you don't want to accidentally, damage their ear or injure, or even, cause pain. Um, but it is good for patients who, can't use an oral thermometer for whatever reason. And, you know, if that's what you have, it's what you have. I'm not the biggest fan of these. This is my favorite. The temporal thermometer. I love, love, love these thermometers. They are very accurate if it is done properly. Usually results in about 1 degree higher than an oral temp. So very accurate. It's an ideal type of measurement because temporal artery is what it uses, and the temporal artery runs right along the side of your head here. That is close to the surface. It's easily accessible. There's a good constant flow of blood there. It's just kind of the perfect storm for goodness. You can use this too on anybody, newborns, infants, children, adults, elderly patients. And it's very, very, very accurate, very easy. And as I had mentioned, though, very accurate if done properly. Okay. Why I say that is I've seen a lot of MAs in the field through no fault of their own. They probably just didn't have proper training. They don't use these properly. If you use a temporal thermometer and you get a reading of like 97 something, it's no, that's incorrect. A lot of people miss the temporal artery with this is the problem. The temporal artery is here, okay? Here, side of your head, in your hairline. And many people will not go over to the hairline and they'll go like down the side of the face. If an MA asks you to remove your glasses to do this, they're not doing it right. There's no reason why you should have to take your glasses off because you literally run it over into the hairline, pick it up and put it behind the ear. You would never hit that, okay? And I will be doing a video demonstrating all of this, by the way. So stay tuned. All right, but this is, yes, absolutely my favorite way to take a temperature. All right, pulse rate. Pulse rate. Pulse rates are how many times your heart is beating. That is what a pulse rate represents, okay? There are different sites in which we take pulses. That is demonstrated or diagram here on the, sorry, had a brain fart there. Diagram here on the screen. There is the temporal artery. Yeah, we don't generally take a pulse there. Carotid, which is the neck, only if the person's down and you're, contemplating doing CPR. The brachial artery is very good for little bitties, young children that their wrist might just be too little for you to grab. The radial artery and the brachial artery is on the pinky side of the inside of the upper arm. The radial artery is the most common site that we use for adults, and that is on the thumb side of the wrist. Femoral artery, no, you wouldn't take a pulse there unless you absolutely had to. It's a little invasive. It's right there by the groin. Popliteal artery in the back of the knee. You need to know where that one is in the event that you would ever have to take a blood pressure in the thigh for any reason. Posterior tibial is on the back of the ankle, basically, and the dorsalis pedis is on the top of the foot. Okay. In the event that you have someone like an infant or a very, 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 very small infant, and you have to take a pulse rate and you can't quite get any of those spots, you can take what's called an apical pulse, which basically you just pull out your stethoscope, put it in your ears, stick the belly of your stethoscope over the heart, and count that way. Pulse rate is measured by the number of taps felt. And when I say taps, I mean boom, boom, felt per 1 minute. Okay. So when you are new to this, you don't want to sit there and count for an entire minute. It takes too long, you're busy, and you'll lose track, trust me, if you try to count for a minute. When you're new at this, best way to do it is to count for 30 seconds and then take the number that you have counted and double that, because 30 times 2 is 60. Yay, a minute, right? Once you get really good at it, and if you're good with your multiplication, you can count for 15 seconds and multiply that by 4. Okay, that's what I do. You'll get there one day. Okay. But if you're not comfortable doing that, just 30 seconds and double it, you're fine. Pulse rate can be affected by age, gender, emotional state, illness, pain, medications. Understand that if we are upset or we are in pain or we are not feeling well, oftentimes our pulse rate will elevate. The reason, let me stop here for just a moment. The reason that you want to know what affects all of these things is so that if you do end up getting kind of a wonky reading, you can have possibly something that will justify it or explain why it's that way. And then if you don't, then you know that something could be wrong and you need to alert the provider to that. All right, so normal adult range. And on all of these, I will give you adult ranges. I will be doing a video for pediatrics later. But normal ranges for an adult are 60 to 100 beats per minute. Most people fall around 70 to 80. If the patient is over 100 beats per minute, that is known as tachycardia, because tachy means fast, cardia is the heart. If the heart rate is slower than 60 beats per minute, it is called bradycardia. Now, keep in mind that you will find some people that are technically bradycardic, but it's not a big deal. Athletes, people that are very, very athletic, in really good shape, their hearts work so efficiently that they don't have to beat all that often. So you can actually see really, really, really fit athletic people down in the like 40s and 50s, and that's totally normal. Some people, their heart beats a little faster. That's fine too. When you want to be concerned and actually alert your provider is when it is way out of range. Okay. So if you had somebody that had like a 38 heartbeat, that would be crazy low. Or 130, that would be crazy high. Okay. That's when you want to let the provider know. Aside from that, some people are going to differ here and there. All right, let's talk about respirations. Okay, respirations are breathing. Okay. It is best to measure this without the patient's knowledge. We kind of psych our patients out on this one, primarily because if someone knows that you're watching them breathe, whether they do it consciously or subconsciously, they'll probably alter the way they're breathing. So you want to do it and have it be the most accurate. So we generally will do this without the patient knowing it. And again, when I do my video on, actually demonstrating all of this, I will show you how to fake your patients out. Respirations are measured as an inhalation, exhalation. So inhalation plus exhalation is 1. Okay, so that's 1 when you're counting. Normal adult range is 12 to 20 respirations per minute. That is known as eupnea. And there's also kind of another way you can kind of decide if you're counting properly. For most people, there's a ratio of 1 respiration to 4 pulse beats. So 4 heartbeats, 1 respiration. Meaning if your patient had 18 respirations per minute, they're going to be around 72 beats per minute on their pulse. Now, it's not always going to be exact. It's not an exact science. It's just that's typically how it works. So if you're not sure, if you come up with a really wonky either respiration rate or pulse rate, you can kind of use that formula and go, like I said, you're going to be close, not exact necessarily, but if it's close, then you know you've probably done something correct. If you're way off, I would retake the measurement. Variations very similar to those of temperature and pulse rate, age, physical activity, emotional state, illness, and certain medications. Variations are very similar to those of pulse rate variations. Tachypnea is an abnormal increase, and that is generally more than 20 breaths per minute. Bradypnea is abnormal decrease, and that is usually less than 12 beats per minute. Hyperpnea is an abnormal increase in the rate and the depth as well, so they're breathing abnormally deep or shallow. Hyperventilation is abnormally fast breathing and deep breathing. That's when people, generally you see this in people that are having like anxiety attacks and things like that. And hypopnea is abnormal decreases in the rate and the depth. Okay. All right, let's talk about pulse oximetry real quick. So this is a pulse oximeter that you're seeing on screen. This little thing that you just put on the finger. This is used to measure the oxygen saturation of hemoglobin in arterial blood. For someone who is fairly healthy, 95 to 99, very rarely will you see 100, but every now and again. So greater than 95 is normal. Anything that is less than 95 but greater than 90 is a little iffy. It means they're not getting quite as much oxygen in the tissues as they should. You'll see 90 to 95 in people that maybe have like COPD type illnesses like asthma, emphysema, things like that. Smokers, heavy smokers. Not a huge like red alert kind of concern, but definitely not great. Get between like 85 and 90 though, that could mean respiratory issues for sure. And you want to alert the provider to that as soon as you can. Once oxygen saturation falls below 75, cyanosis starts to appear, so a bluing around usually the lips and the extremities like the fingertips. Oxygen saturation below 70 is life-threatening. You have to get those people to a hospital immediately and treated. Best place to, and again on my demonstration I will show you this, but the best place to place a pulse oximeter is on the second, or well, third or fourth digit, so the middle finger or the ring finger. If people have really tiny fingers, you can put it on the thumb. I will say really thick nail polish and either gel or acrylic nails can hinder this reading. All right, lastly, blood pressure. What we are seeing here on screen is our sphygmomanometer, that's our blood pressure cuff, and our stethoscope. Sphygmomanometer is the technical term for blood pressure cuff, but you don't have to say that because it's hard to say. It's even harder to spell, but you know, it is what it's called, so you can impress your friends with that knowledge. Blood pressure measures basically the pressure that is being exerted on the walls of the arteries. Okay. So the way we express it or write it is like a fraction. It's a number over another number. Okay. The numerator or the top number is the systolic pressure. The denominator or the bottom number is the diastolic pressure. And what that represents is Systolic pressure is when the highest amount of pressure is being put on the arterial walls, because that is the point at which both of the ventricles, the lower chambers of the heart, are squeezing and pumping the blood out to the body through the arteries. So that's the highest pressure. The diastolic pressure is the lowest point of the pressure on the arterial walls because this is the point at which the heart is resting in between beats. Okay. These are measured in millimeters of mercury. So you'll see on most of these, it says mmHg. There are the newest guidelines from the National Heart, Lung, and Blood Institute say that anything 120 over 80 or less is a normal blood pressure. This is adult. Prehypertension is considered a sustained systolic over from 120 to 139 or higher, over 80 to 89 or higher. And by sustained, that means constant. Some people will have higher blood pressure because they're in pain or something, but it's temporary. Sustained would be over a period of time. Okay. Blood pressure should be taken at every single office visit. Several readings taken on different occasions are always good. It provides a good index for baseline. If a rise or a fall of 20 to 30 millimeters of mercury is observed between various readings, that is definitely considered significant, even if it is still in normal range. Variations, again, like everything else, age, gender, metabolism, emotional state, pain, exercise, illness, medication. You want to know all of this so that you can determine whether what you are looking at in a blood pressure reading is concerning or not. Okay. Also, just ask the patient. Most patients know what their normal blood pressure is. Kind of like me with my body temperature. If you don't have anything to look back on baseline wise, because maybe they're a new patient, or it just seems kind of out of the norm, just ask them. Say, does that sound about right to you? Does that sound normal to you? They'll tell you. I mean, there's some that won't know, but for the most part, they will know. Variations. So we talked about prehypertension. There are two other stages or categories of actual hypertension. Hypertension stage 1 is a sustained systolic over 140 to 159, or 140 to 159 over 90 to 99. Stage 2 hypertension or high blood pressure is anything that's 160 or higher over 100 or higher. Definitely want to get the provider in those cases. Hypotension is low blood pressure. And that is usually anything that's below 95 over 60. Now, some people do run that low. It's fine. But if it starts to get much lower, that can be concerning. And that is definitely when you would want to go see the doctor, grab the doctor. We do want to talk about cuff sizes, and in my video of demonstration here, I'll go a little further into the cuff size, but a cuff should encircle 80% of the arm circumference, but not more than 100. And yes, in the world of blood pressures, size matters. If the cuff is too small for the patient, you will end up with a false high reading. If the cuff is too big, you could end up with a false low reading. And this is one of those things you really need to be accurate. I mean, you need to be accurate with everything else, but this is very, very important to be accurate. You should make sure that the center of the bladder is called, the inflatable bag inside, is directly over the brachial artery, and there are little arrows that indicate it's called an artery mark on the cuff itself. And this helps to allow for complete compression of that brachial artery, because that's what you're listening to when you're taking this. Okay. So that is all I have for you on vital signs. Again, please look out for the video for demonstration for vital signs. Again, if you have not already, please click the like and subscribe, and I will see you guys next time. Take care.